This is a very unique webinar that I'm recording, obviously focused on not only the coronavirus, but the chaos and specifically related to the business strategies. So everybody is hearing that they have to work from home now. And so how do you make working from home work for your team in your practice and particularly through effective leadership with technology and some good crisis management. Um, so I'm going to talk about two different elements of a business here in this time of crisis. I'm going to talk about business leadership. We're going to talk about working on your business and the difference between working on your business versus in the business. I'm going to talk about patient journeys and also a little bit about customer relationship management that is called in the traditional sense. And we're going to talk about more of patient relationship management. But in this case, more pertaining to your patients and how do you manage their relationships. And then we will talk more about messaging, how to set the right tone and how to manage the relationships with your patients. Um, this is a fantastic quote because it really talks about how fear is something that we all feel from time to time, especially now in terms of uncertainty. And it is a natural thing to feel fear. We all need to acknowledge that fear is a natural thing and it is all actually quite healthy. And you as providers know this more, but I'm putting it in context of business leadership. Uh, the message in this webinar that I will emphasize is to recognize and learn that it is there, the fear is there, accept it, and understand that it is there for a reason, and use that fear in a way that is helpful um, instead of using it in a way that is going to paralyze us and our patients. You're good at managing this from a patient perspective, but I'm talking about it more from a business leadership perspective. Um, how do leaders deal with what is happening in the time of crisis? We'll see if you have not already how people, such as staff, your patients, friends, family deal with this. They're really afraid of what's going on, what is going to happen in a way that they are unable to do anything but just sit and get all worked up, watch the news and social media constantly, and it paralyzes them, honestly. And as providers and business leaders, you are a source of guidance for everyone, your employees, your patients, your friends, people that we interact with daily. All of these people are influenced by what you do, what we do as business leaders. So these are 3 points that are easy to remember. Obviously, be honest with yourself and with other people. Again, being honest with patients has been, you've been doing that for years. That's what you do. But recognize that there are going to be difficult times ahead, and we don't want to try to sugarcoat anything. We don't want to blow things out of proportion or create unnecessary drama. But trust starts with truth, as you know. Uh, this is something you do as providers, as I said. So you just need to extend it to others. Have a plan. Think about the contingencies, no matter how extreme. How will your team communicate with patients? How will they communicate with each other in a calm way? Be a resource. Your team is looking at to and at you for guidance. And great leaders are open to ideas and accept criticism, even in the most difficult times. Accomplishing these things can be difficult, but in a modern era, like all other times in history, communication is a key. Your team, your patients, your vendors, will be influenced by what you say and how you say it. Um, Now, here's where I'm going to talk about working on your business, on your practice. It means taking a step back and we think about what is the purpose of our practice. What is the purpose of our business? Why are we in the business to begin with? Um, Thinking more strategically. This is exactly what leaders do. How can we do things a little bit better? I had written about workflow in my previous newsletter, and this is a great time to step back and think about your practice workflow efficiency. Um, Things are forced right now with very little control in your hands. Many people working from home, some in your office, and patients are forced to stay home. They may be quarantined. After all this is over, you have to think about what is going to change about our environment. When things start getting normal, how is it going to change how you want to work in future? Do you really need all your staff in the office? Can you work with remote staff? Distinguish between people that want to versus need to be in the office. Front desk schedulers, back office, people that do authorizations and pre-certs, and so on. What about dedicated telehealth hours? That will determine the new tools that you may need for making this happen. You are today probably forced to communicate with your team and patients more effectively, perhaps real time. Can you consider using tools like patient relationship management uh, that you never considered before? It's a game changer. The purpose uh, is to use the previously described methods of working on your business. If telehealth, for example, is effective in today's environment, why not extend it when things get normal? Of course, you'll have to evaluate the pros and cons with respect to insurance and reimbursements and all that. And my guess is that it will be more accepted by the payers going forward. So you need to evaluate who your patients are, what kind of patients you're seeing, what kind of appointment types, and see which ones can be converted and used for or in a telemedicine, telehealth environment rather than having patients come into your office. Take a step back away from this. Remember, our job as business leaders is that we have to be prepared. It will get worse before it gets better. The economy will get worse before it will recover, but recover it will. And how will human behavior change? It is not like once they lift the ban, everyone will go back to working exactly the way they used to. Think about the behavior change after 9/11 and after 2008. So, when we first saw coronavirus, we were in a denial stage. Oh, it's China, it's their problem, it won't affect us. Oh, we're the United States of America, protect us, and only a small percentage of us will be affected, if at all. Then we came into, and today we're in the acceptance stage. We're past the denial. We're in the acceptance stage now. Um, that we know that many people will be affected physically. The economy will suffer. We know that. We have seen it's probably not probably definitely going into a recession, and the government may not be able to help us as much as we thought they would. So the As we go through the acceptance phase, then we will emerge into a thrive mode where we set new expectations, new normals. We will adapt how we work, we'll change, we'll leverage the tools that we have. We might even discover and use new tools. And we have to help those around us in getting there. And that's what we all have to do. You for your patients, me as your friend, as your consultant, as whatever you want to call me. We have to work together to thrive and get beyond this. Um, this passage finally has always resonated with me from the Lord of the Rings, and it really says about what we are going through, isn't it? We wish, of course, that it would not have happened to me, but as Gandalf said, um, it is not for them to decide. All we have to decide is what we do with the time that is given us. So let's rise through this, and please uh, go through the thinking process of thinking about the on your business and what can we do? How do we communicate with our patients and our team? And if there's anything I can do in the process to help you, uh, please feel free to reach out to me. I look forward to continuing dialogue with you all. Thank you.